Good afternoon, everyone, and thank you for joining us this afternoon for a discussion and webinar on mastering healthcare transactions. We're going to give a strategic approach to operational compliance, understanding safe harbors, and regulatory challenges. Next slide, please, Teresa. Quick overview about MCRA. We are a global CRO and advisory firm that hosts 25 plus former FDA officials, one of the largest talent pools of former FDA regulators and leaders in the industry, with over 100 plus coding payment applications, 1,000 plus clinical site relationships, and involvement in projects in med tech, med device, and life science across the country, and hosting a 100% PMA approval rate, which is the best PMA track record in the medical device industry. At MCRA, we offer a host of services, including our global CRO designation, which includes regulatory, post, and pre-market services, helping you bring product innovation and ideas to market. Our REMA team, which helps with reimbursement, health economics, and market access. Quality assurance and staffing, from assessments to design support, as well as compliance systems. Our healthcare compliance and GDPR team offers a slew of outsourced chief compliance officer services, including the HIPAA and GDPR space. We offer due diligence and transactional services, which include market research, regulatory compliance, and our AI and imaging center team offers regulatory support, clinical study design and execution, as well as statistical analysis. Just some logistics for the webinar today is, if you have a question, please submit them using the Q&A function located in the bar at the top of the screen. We will answer them towards the end of our webinar. If all registered participants will receive a recording of the webinar after the event. If you somehow joined and didn't register or don't get it, please feel free to email info@micra.com. That'll also be the email you can use to get more info to reach Phoebe or myself, as well as a PDF of the slides from the presentation today. Today's presenters are myself, Hassan Abdallah. I serve as the head of healthcare compliance here at MCRA. I oversee all of our client-facing compliance services, which, as shared earlier, include a myriad of chief compliance officer on-suite services. So anything from corporate compliance risk assessments, policy procedure development, anything really living within the 7 elements of an effective compliance program, as well as assisting our regulatory and clinical team with any of compliance, clinical, med device questions as well. And with me co-presenting today is Phoebe Roth. Phoebe is an attorney at law at Day Pitney and primarily focuses on healthcare representation in the transactional space as well. But I'll also allow Phoebe to introduce herself and tell a little bit more about her background.
Thank you so much, Hassan. As he said, my name is Phoebe Roth. I'm a healthcare attorney. I practice law at Day Pitney, focused in the Connecticut office, although I'm barred to practice in Connecticut, Massachusetts, and Rhode Island. So I do some work in all 3 of those states. I focus my practice on mergers and acquisitions, regulatory compliance, and general business and corporate matters for healthcare providers. And I work primarily with hospitals, ambulatory surgery centers, and large physician group practices, but I do some other work with entities like medical spas and other companies in the healthcare space.
Thanks, Phoebe. So some objectives and key takeaways for today. We're going to dive into a lot of information here revolving around healthcare transactions, best practices. We're going to talk about some key risk areas, really focusing on 4 main rules and laws that govern, for the most part, healthcare transactions across several industries. We're going to talk about enforcement trends. We have actually 2 case examples that we're going to discuss. Then we're going to talk about the compliance and operational side of that and how compliance and legal work together in the transactional arena. Some practical risk strategies. What are some things that can be done on the pre-transaction side? So everything from RFI and due diligence to pre-closing and then post-closing. And then we're going to talk about some real-life case applications as well. So let's start off with understanding healthcare transactions. Healthcare transactions span a wide range of activities within the healthcare industry. This includes acquisitions, joint ventures, affiliations, vendor and service contracts, provider employment agreements, and more. Each of these has triggers and implicates different regulatory standards as well as regulatory and legal requirements. So there's always an interplay between legal and compliance teams. And what that means is that there will always be a focus for legal on structuring the transaction and mitigating liability and ensuring certain contract terms apply or are at least being written within the contract agreement itself. And compliance teams are always looking at this from an operational lens, both pre and post closing. And a lot of times there's a lens that I will look at transactions through as a post closing, meaning how are we, once a transaction closed, particularly that involve an acquisition or joint venture, is how are the two entities or the two teams or the operational stakeholders speaking to one another, right? Is what is actually being inherited in an acquisition. And we're going to talk about later on how we be able to identify those early on. What are some compliance integration and compliance risk mitigation strategies that can be happen. And then compliance is always going to be focused on flagging practical implementation issues missed in contract drafting. A lot of times in the transactional space, there's a lot of boilerplate language that is used. And sometimes when that happens, that sometimes may oversee or undermine the operational implications of some of these transactions. In a post-transaction world, effective transactions never stop at closing. The regulatory concerns begin to surface and come out after closing. And so regulatory integration, whether that's aligning compliance programs and protocols, entities use different GRC, which is governance, risk, and compliance tools, and how they identify certain compliance issues. And then how do the two entities, whether they're coming together or working separately, work through various compliance issues that impact their organizations differently. And so these are all going to be essential in reducing long-term risk. There's always high stakes in these types of transactions. Transactions often involve really high financial value, and they carry substantial regulatory and reputational risk, especially in the world of the anti-kickback statute, Stark Law, HIPAA, and state-specific corporate practice of medicine rules. You're going to hear us refer to that as CPOM throughout the presentation today. And so poorly structured deals can always lead to enforcement action. Truthfully, a lot of times what's happening in the transactional space is transactions themselves increase the regulatory and enforcement radar on certain organizations based on that activity. And so as you'll hear us talk about a lot today is how certain transactions, certain due diligence has to be done so far in advance. And a lot of times one of the challenges that I deal with, and I'm sure Phoebe, you do too, is we're often brought in a little bit too late. And so I always say, the question is always asked, well, when is a good time to talk to compliance or legal? Always and early and often. And you want to get us involved there. Next slide, Teresa.
Okay, great. So we're going to discuss some key regulatory issues that compliance and legal will deal with in a transaction. First, the anti-kickback statute. This is a federal law that prohibits offering or receiving payments to induce or reward referrals of business or items that are reimbursed by federal healthcare programs. Violating the anti-kickback statute is a felony, and it can be punishable both by fines or imprisonment. The statute has very broad reach, and it applies not only to healthcare providers, but also many other entities, including medical device companies, pharmaceutical manufacturers, labs, all sorts of stakeholders. So it's important to be aware of this law. Also important to note here that it's an intent-based statute. So in order to be found liable for violating this law, you have to have the intent to do so. So that's one key law that comes into play in healthcare law, healthcare transactions specifically. Another key law to understand is the Stark Law. This is also known as the Physician Self-Referral Statute. This is a little bit different from the anti-kickback statute. It's a strict liability statute, meaning that there's no intent to break the law required. So this law prohibits physicians from referring patients for receiving designated health services payable by a federal healthcare program with which the physician has a financial relationship. And those financial relationships can include ownership, investment interest, or compensation arrangements. And here, compliance is complicated with Stark, and it can be difficult. It's important to talk to your legal and compliance teams here. There's an interesting quote from a federal circuit court judge that I think sums it up well, which says, it seems as if, even for well-intentioned healthcare providers, the Stark law has become a booby trap rigged with strict liability and potentially ruinous exposure, especially when coupled with the False Claims Act. So this is something you definitely want to talk to your compliance teams about. So here it involves physician referrals. It also involves designated health services. So the law will only apply when certain services that are determined in advance by the government, only if those services are coming into play. And some examples of those services include clinical laboratory services, imaging, radiology, and there are other services as well. So this law comes into play a lot in healthcare transactions when there are physicians involved in a hospital, surgery centers, or any kind of group practice specifically. Another key law to understand is the Federal False Claims Act. So this imposes liability for submitting false claims for reimbursement by the government. And this is driven by whistleblowers. So interesting about this statute, it's not a healthcare law. It applies to healthcare, but the law was passed during the Civil War to prevent fraud from government contractors. So it can really apply to any false claim to the federal government. This law is important because, as I mentioned, it's driven by whistleblowers. And a whistleblower who sees some kind of false activity can file a lawsuit. They're called qui tam suits. And the government can join if they wish to do so. And if the case goes to trial or settles, the whistleblower can receive 10 to 30% of the overall settlement. So this is a very big incentive for whistleblowers, and the settlements can be very large. Like I said, it's not a federal healthcare, it's not a healthcare law at all, but it does come into play very often in the healthcare field because of the Medicare and Medicaid claims submitted to the government. Those are government claims under this statute. Another key, or a couple more key laws to understand, the HIPAA privacy and security rules. HIPAA protects patient data, and it is relevant during the due diligence and post-closing operations. So here, during a deal, it's very important to look into whether there have been HIPAA violations in the past for the target. Also, you can look into potential indemnification for those violations or future undiscovered violations. So that can be a big area of liability for companies. And lastly, as far as key laws we wanted to mention, are state-specific corporate practice of medicine. So those are CPOM laws. Now, these can vary quite widely, but in general, the purpose here is to prohibit corporations or any non-licensed entity from practicing medicine or making clinical decisions. So here, the law that would apply would be the jurisdiction of your transaction. And really some key things to remember are that non-physicians cannot control clinical decisions. And where this comes into play often is where you may want to structure an arrangement as a management services organization. And this would allow a non-physician entity to control management of some sort of healthcare provider. And then you can set up a clinical entity that's owned by a physician. And these two entities can work together through contract, and the physician can have a restriction agreement so that they cannot sell the clinical entity. And so those are management services organizations.
Hey Phoebe, before we get into maybe some of the key safe harbors around some of these laws, when it comes to the Stark law, I know a discussion I have all the time is, well, what's considered a benefit, right? What's considered some type of financial remuneration
Yep.
for physicians. And so I know a lot of times we see this in real estate deals, whether it's discounted or free types of real estate. Can you talk a little bit about that and some of the issues that you've seen most recently, especially with the rise of private equity investments into the healthcare space and how that kind of implicates Stark Law analysis and assessments?
Yeah, absolutely. So financial relationships can really vary under the Stark Law. You can see some kind of arrangement where the physician has an investment in an entity, or you can even see a financial relationship where the physician is simply employed. And going even further, the Stark Law does look into both direct and indirect compensation relationships. So when you're analyzing these issues, what I always do, and I think a lot of lawyers recommend, is to draw out the entire corporate structure, and you can look at all the different owners, and then you can look at all of the different financial relationships. And even if the physician does not have a direct financial relationship with the entity to which the physician is making referrals, you want to make sure that through whatever complicated structure, be it with private equity or any other structure that exists in this entity, you want to make sure that there is not an unbroken chain, because if there's an unbroken chain of financial relationships, then you can implicate the Stark Law. And as I mentioned, the Stark Law is tricky because it's not intent-based. So in analyzing these complicated structures, you have to make sure to catch any Stark violation and make sure you fit into an exception, or else you violated the law. And it doesn't matter whether or not you have the intent to do so.
Yeah, that's a great point there. I think we go to the next slide, Teresa.
Okay, great. So we wanted to address a few safe harbors and exceptions to the anti-kickback statute, as well as the Stark Law. So as far as the anti-kickback statute, just to provide a little bit of background, the safe harbors to the anti-kickback statute provide protection from anti-kickback liability when they're fully met, meaning when you meet every single requirement of a given safe harbor. The safe harbors are completely voluntary, though. They're not mandatory. So if you fail to fit within a safe harbor for a given arrangement, that does not mean you've automatically violated the law. Instead, what will happen is that your arrangement would instead be assessed under a facts and circumstances analysis. And this analysis is to evaluate whether there was improper intent behind your arrangement and if there's illegal remuneration being exchanged between parties. And as we mentioned earlier, the anti-kickback statute is an intent-based statute. So that's really going to be what regulators would be looking at here in your arrangement. And the safe harbors, there are over 35 safe harbors. They really reflect the government's enforcement priorities, and the safe harbors are examples of arrangements that the government has looked at and determined that they're very low risk. So a few key ones here that we wanted to just mention briefly. The ambulatory surgical center safe harbors are a useful tool. ASCs are a growing industry and their growth is expected to continue. And the government is in favor of them because they are great for patients. Patients have really good outcomes, and they also are significantly less expensive than hospitals. And that's a great benefit to patients as well. So here, there are 3 separate sets of requirements for 3 different kinds of safe harbors. So there's a single specialty ASC safe harbor, a multi-specialty ASC safe harbor, and physician-hospital joint venture safe harbors. And so these safe harbors protect physician ownership and referral arrangements to ambulatory surgery centers. And so just to touch on some of the requirements for these, for the multi-specialty ASC safe harbor, which I've seen a lot, and I think many ASCs have multi-specialties within the ASC, in this case, physicians will have to comply with a rule called the 1/3, 1/3 rule. And this rule requires that at least 1/3 of a physician investor's medical practice income from all sources comes from ASC procedures in the past year. And it also requires that 1/3 of the procedures performed by the physician in the past year is performed at the investment entity. And so this is in order to ensure that the physician is using the ASC as an extension of his or her practice rather than as an investment vehicle to increase referrals to federal healthcare programs. Just a couple others to go through. The personal services and management contract safe harbor is a very useful safe harbor to the anti-kickback statute. Here, this protects arrangements where an individual or entity provides services or management to a healthcare provider or organization. This safe harbor requires a written agreement with a term of more than 1 year, aggregate compensation set in advance and consistent with fair market value, and that the compensation is determined in a manner not related to volume or value of referrals. So when you're doing work with the anti-kickback statute, you'll see this language a lot. Volume or value of referrals is prohibited for any kind of calculation of compensation. So this is great for things like medical directorships, billing services, and administrative support agreements. Let's see. Just one good resource I wanted to mention to all of you when you're looking at anti-kickback issues. A great thing to look at is the OIG advisory opinions. So these are opinions that are voluntarily requested. They're based on specific circumstances of a requester and their own arrangement. And they're just fact-specific guidance. They're not binding, but in certain cases, it's hard to find case law on a very specific arrangement that you may be trying to structure. And this is just a great thing to look at. These are public. You can find them online. And they relate to almost any kind of arrangement you can imagine. So I would recommend taking a look at those when you're working with the anti-kickback statute. And then just to discuss a couple of Stark exceptions. As we mentioned, the Stark statute is a strict liability statute. So if your arrangement implicates the Stark law, meaning if you have a physician referring a patient for designated health services to an entity with which they have a financial relationship, you need to fit that into an exception or else that is an illegal arrangement. And some key exceptions here include the in-office ancillary services exception. This one is used quite a lot. And this one here applies when a physician is referring a patient for designated health services within that physician's own practice. And here, an important thing to note about the Stark law, and this is one of the kind of complexities of the law, is that in order to qualify for the in-office ancillary services exception, the practice has to qualify to be a group practice under the Stark law, which is a very specific regulatory definition. And there are many different requirements, including you have to have a single legal entity, you have to have at least 2 physicians, and there are quite a few others that I don't want to get too much into the weeds, but in order to use this exception, you need to make sure that you are a group practice. So that's just something to know about these exceptions.
Yeah, Phoebe, really quick before we maybe jump into the next slide, just on 2 pieces. One, an area where I see a lot of the personal service arrangement safe harbor come up, particularly after the ECRA changes, the Eliminated Kickback and Recovery Act, is in the laboratory space, because that was an industry kind of taken by storm where, you can no longer pay business development and sales reps or marketing reps in that space based on volume. And so a lot of that, and now with the rise of med spas, medical directors are looking at how do we now compensate ourselves? How do we, because a lot of times they're the ones driving patients into those med spas, right? And a lot of times those med spas are in the same locations as them. And so kind of balancing all of that along with the fair market value assessment is where those conversations with clients and physicians gets really difficult, because on the surface it looks like, well, I checked all these boxes, right? But from a regulatory enforcement interpretation side, maybe talk about how you have those talking points with clients about how, what is it is you're looking for to ensure that the elements of the deal are meeting the safe harbor requirements.
Yeah, so I think in those conversations, what really matters is understanding the deal very well and being able to kind of see the whole picture and then being able to look through the various safe harbors and exceptions and see what you can either fit into, or in the case of the anti-kickback statute, how close can you fit into a given safe harbor. So I think it just involves understanding your client well and then being sort of creative and just very detailed about how you can help them to comply.
No, that's a great point. And then one last point about the OIG advisory opinions. A lot of times, particularly physician entrepreneurs or healthcare entrepreneurs who have looked to OIG advisory opinions and want to now model a business after it, a lot of times they will get well, hey, I read about an entity that structured their business this way, and we're essentially doing the same thing, right? And it's really important to understand that the opinions are highly fact specific. And so if your business arrangement differs even slightly, that applicability of the advisory opinion is very limited, because oftentimes people will, note that the advisory opinion is within itself a safe harbor, and it can be to the requester based on the described conduct, right? And so as a requester in a OIG advisory opinion, you would put forth a business arrangement, an idea, or a question to the OIG stating a very specific fact pattern or set of facts that applies, and that is what it's applicable to. So it's a tremendous tool for the requester itself, and it's a great way to help kind of navigate or chart a path forward for the business. But it's also something that, to kind of take with a grain of salt for any other entity to read about it, learn about it, but understand that that is a very fact-specific opinion that's being given.
Absolutely. Yes. Binding only on the requester. And also, I think they note in the opinions that if the requester has omitted any facts or circumstances, yes, it's not binding. Absolutely. So, yeah, you can only use these as a guide and a resource. They're not case law, and they're not binding on anyone.
Next slide, please, Teresa. This is yours.
Great, terrific. So yes, so what is the role of legal and compliance in structuring deals? So first of all, fair market value assessments and commercial reasonableness is highly important to any deal. Legal ensures compensation aligns with fair market value, and compliance ensures it's commercially reasonable and not volume revenue based. So the concept of commercial reasonableness is really a key concept in healthcare compliance, especially when it comes to the Stark law and the anti-kickback statute. So this really refers to whether an arrangement makes business sense for the parties, and even in the absence of referrals. And according to CMS, an arrangement is commercially reasonable if it furthers a legitimate business purpose of the parties. So, for instance, if there's a contract for fair market value, but there's absolutely no use for the services, that would not be considered commercially reasonable, even if it is fair market value. So that's something to just be aware of. Let's see. Other key points when it comes to the role of legal and compliance are contract review and compliance vetting. So both of these functions review contracting terms to ensure adherence to the anti-kickback and the Stark law. The contract review is really a key part of the due diligence process, and this involves identifying key legal issues like the regulatory issues we mentioned earlier, and that'll be a key part of the transaction. Then other legal and compliance coordination during M&A due diligence. So legal will identify exposure, whereas compliance evaluates internal policies, training, and prior violations.
Yep. Sorry, yeah. Phoebe, just a quick note. One piece is, that I always talk about is it's really important for both legal and compliance. And in every organization, the relationship is a lot different, right? A lot of some organizations, they work very closely. There's a lot of good communication. Some organizations, they're very siloed, very separated. And especially in an M&A deal, it's really important that compliance is involved early on, because again, as I stated early on, there's so much operational implication post closing. And so a lot of what's happening is post closing now, particularly if you're the acquiring entity, right? You're looking to see now, well, the issues that we just purchased start to come to the surface. And so what does that look like? And what kind of monitoring and auditing are we going to do of those issues? And then how do we communicate that to legal? And so early on, it's important. I always, like to work with legal counsel to identify, well, what are going to be the top things that you're going to be most concerned about post closing? What's at the height and at the top of your risk map that you want us to be aware of? And then let them know what some of the things that we're concerned about as well that we found in due diligence. Because a lot of times compliance may highlight things in due diligence, but it's not necessarily going to stop something from closing, but it means it's something we want to pay really close attention to after the deal is closed. Um, Rarely, and in some instances, or in some rare instances, you might have something that's high risk enough that could impact things during the negotiation phase, right? And so now we're talking about, not only renegotiating certain terms, purchase points. We're also talking about potential structures where we're parceling out some type of payment structure that's contingent upon certain compliance considerations being closed out. And I always emphasize how important it is for those two departments, those two teams to be working closely together to identify those things early on, but also making sure they continue to work together. Because a lot of times what happens is deal closes, we're so busy in the operation of the business, we kind of lose sight of them. And so it's so important to ensure that, pre-deal risk assessments are then post-closing monitoring efforts. And so pre-deal risk assessment findings have to become very active monitoring efforts for your compliance team after the deal closes.
Yeah, absolutely. I think that's a great point. And just to your point about how the due diligence pre-deal can affect the purchase price, there are so many things that you can do to structure your deal once you understand what you found in due diligence. So not only the purchase price can be affected, but you may want to revisit your reps and warranties, your indemnification provisions. You may want to negotiate or renegotiate escrow provisions on issues that may arise. So really, and of course, all of the regulatory issues we talked about can come up in due diligence when you're looking at the overall structure of the deal or the individual one-off sort of contracts that exist within the business. You want to look at those as well and find out what's going on there. So overall, it's a really important part of the process and just a great coordination between legal and compliance.
Thanks, Phoebe. Next slide, Teresa. So we're going to dive into some operational risk strategies and how, when anticipating a potential transaction or entering into a transaction, what are some of the considerations that your compliance program should be taking, and then what does that look like? And so when we look at the DOJ, the Department of Justice evaluation of corporate compliance programs, it specifically spoke to this. And while it's labeled specific towards M&A, this is really going to be applicable for any type of transaction. And it states that a well-designed compliance program includes comprehensive due diligence, which we've touched on a few times. But one of the key pieces here is in that final sentence where it states flawed or incomplete pre or post acquisition can allow misconduct to continue at the target company, right? Causing and resulting harm to a business's profitability and reputation. And so this is where this is, I don't want to say often an overlooked portion of the M&A deal, but it's often not the most, the prettiest part of a deal, right? It's not at the top of every discussion when we're talking about reviewing P&Ls, because sometimes some of these risks have not either surfaced to the level of a potential enforcement penalty, nor is that potential penalty somewhere accounted for in the financial calculation of the deal, right? And so I always talk about how it's important, and we can move on to the next slide here, Teresa, that in the due diligence process, we're asking these questions. And so the guidance lists some really good one is, if there was previous misconduct, right? We want to look at what was the process to identify that misconduct and how was it handled? Was it a part of, was the misconduct identified during due diligence? And this was the first time that it was ever known? Or was this something that was known and then not addressed again? Because now that tells you about, well, what type of culture of compliance are we getting into? Whether it's a merger and acquisition deal or it's a deal with a third party vendor, because ultimately in the healthcare institutions, we are still responsible for our third party vendors that are providing services for our patients or our end clients. We also want to ask questions as what has been the company's process for tracking and remediating misconduct? What I love to ask for in due diligence early on is, when was the last time a risk assessment was completed and what were the findings of that risk assessment? And since then, and then looking at some of the more high risk findings of that risk assessment, what has been done over the last year? Were these high risk findings a part of an annual audit work plan? Were they addressed? And then on the post transaction side is there a process in place to ensure appropriate compliance oversight? Are we inheriting a full compliance team? What responsibilities does that team have? And so these are all very key risk mitigation strategies that are necessary to be done early on in the due diligence process and throughout. And so I want to kind of transition into the next slide to talk about what are some good RFI or request for information procedures that should be implemented during any type of corporate transaction. You always want to establish clear compliance and risk baseline, including a structured gathering of billing, privacy, and defensible due diligence. We want to be able to create an audit trail of a compliance inquiry. We also want to the point earlier that Phoebe had made, we also want to identify certain things that might enable some renegotiation or enable us to relook at things like representation and warranty provisions or indemnity protections. Or, as she mentioned earlier as well, any type of due diligence findings that would impact things in escrow, so that we have holdbacks for identified risks. And as I'm doing my due diligence right now, I'm identifying the misspelling of the word compliance in the first bullet point. And so you can see, even when doing presentations, it's really important to make sure that we have proper due diligence in those. But your RFI stage and the portion of that transaction is so critical. And what a common best practice that I like to have is, as opposed to just sending an RFI via email, I always like to have a call that goes over the RFI. And so that I'm speaking with the stakeholders who are going to be responding to that RFI, so that they understand what is the intent of my request and what are the specific deliverables I would be expecting in responding to that request. I also want to make sure that they have room to ask questions or to identify something that they may not have. So now I'm able to, early on, as opposed to waiting, we want to establish a very clear timeline as well during that RFI period. So these are all really good best practices that should be implemented early on in your RFI process. And so we're going to transition into some real case spotlights here in the next slide. And Phoebe is going to discuss one that we've been looking at in the Innovasis settlement.
Yes, absolutely. So this was a $12 million settlement under the False Claims Act. And we discussed the False Claims Act previously. This is the whistleblower statute. Here, the company allegedly paid spine surgeons through inflated IP licensing and travel perks in violation of the anti-kickback statute. The improper compensation and lavish entertainment, and the payments lacked substantial value or bona fide usage, including things like ski trips, luxury dinners, and family events. Leadership was also implicated in this strategy, including founders and top executives who were involved in structuring and facilitating these inducements. So just some takeaways here about this case. Fair market value assessments have to be real and defensible. And this kind of involvement from executives can amplify the risk. And so when you're looking at these types of compensation arrangements or any kind of bonus or payment for entertainment, you have to be very careful, because this has been an area of government scrutiny for many years in the healthcare field. And we see that in many other industries, this kind of practice is fine for marketing, to take someone on a trip or take someone to a nice dinner. But in healthcare, because the healthcare providers are referring patients for government services, this is not acceptable. So this is just an area to be very careful of. And one suggestion that I have here is, if you have an arrangement that you're looking at, it can always be useful to hire a fair market valuation company that specializes in healthcare. Here, you can order this type of valuation, and in the event that you're ever looked at under government scrutiny, you can have this to back up your practices. So this is, but in general, just these types of payments are often the subject of government enforcement. So just something to be aware of and be cautious of.
Thanks, Phoebe. We're going to jump into another case in the next slide regarding cardiac imaging. And this too was another case initiated by a whistleblower, is actually a former billing manager. And before I get into kind of the high level overview of the case, I want to talk about why whistleblower cases usually come up, not always. Is a lot of times when reading some of these cases, the whistleblower, this is not the first time that they're talking about this or bringing this to someone's attention. And that's a key piece in the enforcement considerations and the legal enforcement that's taken upon a company. And so when I think about that, I think about, well, that also speaks to the effectiveness of that company's compliance program, right? And it talks in terms of, well, you might have a compliance hotline or a methodology, or you may not, for individuals within the company to raise questions of ethical concern or just raise questions about compliance overall. But it also means, well, what are you doing once you receive those inquiries, right? And what's that process? Because that is so critical to ensuring that issues that are raised through your compliance hotline and compliance protocols are handled with the level of seriousness of the potential severity of that claim. And so this was another one where the billing manager had, and several times, cited issues with the billing processes, issue with the billing protocols. Cardiac imaging was found settled on at an 85, almost 85.5 million settlement for anti-kickback and Stark law violations. There was obviously payments that were far exceeding fair market value. And then they were also paying referrals to cardiologists and excessive fees to supervise these mobile PET scans. Another key piece here is that they were then forced into a corporate integrity agreement. A corporate integrity agreement is an agreement that happens between the entity and HHS-OIG and the Department of Justice. It's a 5-year agreement, and it usually requires very, very strict compliance requirements for the entity. Most of the times that includes stripping and or hiring an independent or a new compliance officer, having very strict metrics and milestones that must be met. Usually the HHS and OIG or DOJ will appoint an individual that will continue to perform monitoring of those compliance requirements and making sure that they actually happen. You can, when you're reading about this case, it's really important, and it illustrates how in any type of healthcare transactions, whether it's implicating with physician arrangements or otherwise, that you continue to utilize, to Phoebe's point, an independent fair market value analysis, because they had stated one in their defense here. And so to Phoebe's point, it's so critical to use a fair market evaluation firm that has good industry experience, because here there was a sham supervision and an invalid fair market value analysis that the company had tried to use in its defense. So again, highlighting really key important pieces there regarding the fair market value assessment. Next slide, Teresa. So these are just a few more strategies to recognize and mitigate some compliance risk. We've touched on all of these, but some key red flag indicators when thinking about or reading about transactions is looking for high compensation without deliverables, right? So there isn't some type of commensurate deliverable to the compensation, particularly in medical directorships. There's kind of vague service descriptions that doesn't really pin down what the service is being provided and to what benefit. Always use tailored questionnaires around your risk assessments. Be very specific to the deal itself. Include employee interviews and look at some historical claims to identify any potential weaknesses that you could be inheriting or getting yourself into. And then obviously having, training and oversight systems. We've talked about this incorporated in your onboarding. You should have proper compliance liaisons and escalation protocols. Phoebe, anything else here that you wanted to add?
No, I think you hit on all the key points.
Okay, great. Next slide, Teresa.
So how can legal and compliance work together? We've discussed this in previous slides, but alignment can really strengthen the risk posture in your transaction or any healthcare arrangement. And when it comes to this type of work between legal and compliance, early coordinated involvement can create holistic insight into regulatory and reputational risks. As we talked about, when you are engaged in a transaction and you acquire some other type of healthcare entity, you can be responsible for the misdeeds of your predecessor. You can open up yourself to patient lawsuits, employment issues. So there's a lot to think about and a lot to consider. It's important to work together across different teams. So using shared systems, coordinating new work, coordinating processes for handling contracts, and just working together for common goals can help to identify and manage any sort of risks early on in the process. And really a good best practice is to share ownership of audit outcomes. So here, legal and compliance teams should really work together to respond to audit results, to fix any issues that may be found, and to decide if and when whether to report any problems located in an audit to the regulators. So self-reporting is something that you can always think about if an issue arises, but it's really something that you should discuss with your legal and compliance counsel. And you need to be careful here because self-reporting can be very beneficial, but it's not legally required under all circumstances, so it can actually be to your detriment if you report in a case it's not required. So for instance, just a quick example that I reviewed a staffing issue for a healthcare entity recently where the provider was concerned that a former employee had improper credentials under Medicare. And we looked at some very specific state licensure laws and determined that self-reporting was not required. In some cases it is. So that's just something to be aware of and to look at every instance very carefully.
That's great. All great points there. Next slide, Teresa. So just some lessons from the deal room. Obviously, Phoebe, you have done several transactions across various sectors within the healthcare industry. I know you and I in past have discussed a lot of times, whether it's laboratory deals, ambulatory ASCs, and a lot in the upcoming trend and emerging industry of private equity in healthcare, whether that's in med spas, whether that's in rehab centers. But a question for you to kind of round out our discussion here today is, what are the biggest challenges you're facing and you think that compliance teams are facing as well in collaborating across healthcare transactions, whether that's with opposing counsel, and what strategies can help overcome them?
Yeah, so I think some really big challenges that can be involved in a healthcare transaction can be to really just pay attention to both federal and state laws, because healthcare laws differ so much from state to state. And we do work in deals that span multiple states. So just to give one example of this, I worked with a large hospital system to acquire a large group of clinics. And the structure of the transaction involved some issues related to the corporate practice of medicine, which we talked about earlier. And those laws were different in each of the states where.
Okay, we may have lost Phoebe there for a minute. I'll wait for her to get back. But to pick up where I think she was going with this, and something that we similarly see is oftentimes when you're dealing with transactions that implicate different state laws, and so or you have entities or structures that are being acquired that operate in various states, there's often a need to do a multi-state kind of compliance matrix or risk assessment. And so when that happens, it's really important to take the time to understand how those different state laws implicate the deal itself. Is it possible? What are the operational implications? Do we have the ability to maintain compliance over those various functions? And how do in some different states, even impact the structuring of the deal? Because as we said at the top of this presentation, it also means that sometimes different states have different corporate practice of medicine regulations. And so when what that happens is, does that mean that we need to stand up or create a potential MSO deal or MSO model where we have a master or a management service organization that is going to manage certain of these services? And what does that mean for the structuring of these entities as we move forward in the deal? And so I think Phoebe is just got here. She computer frozen. I'll go out and log back in. So I'm going to give her the opportunity to do so, and then she'll wrap up with her final points. But as we do want to look to see this would be a good time, Teresa, to go into the questions section and see if there are any questions from the attendees. I know we did such a great job that we left no question unanswered. Right, and while we're continuing to allow Phoebe to come back in potentially, a few things that I want to highlight, and Teresa, if you can maybe bring back up that last slide. Sorry, I lost it. Yep, there we go. Thank you. If you have any questions for myself, it looks like somebody has a raised hand. Jeff, yep, please, Jeff, if you want to enter your question into the Q&A prop, that would be great. As I think it'll be difficult to manage unmuting while we're in presentation mode. Yeah, so we'll be happy to address that question in the Q&A prop. But of course, if you have any questions about MCRA or about the presentation itself or the services we can provide, my email is on the screen. Phoebe's email is on the screen as well. Again, a kind of a closing takeaway from this discussion is that healthcare enforcement and healthcare transaction is in a wildly unpredictable area right now. With a lot of the emergence in private equity across, I think that's Phoebe now, across the industry. What's been happening is we're seeing kind of new trends in what type of healthcare entities are being brought up. Obviously, that includes entities or structures like compound pharmacies and tailored care. I think that's going to be an area that we continue to increase. And now that we have my co-presenter back, I'll let Phoebe wrap up her final points there from that previous slide.
Yes, great. Sorry for the interruption, everyone. So yes, just some challenges as far as the deal process. I think I was saying the interplay of state and federal laws when it comes to corporate practice of medicine, licensing, registration of different kinds of medical equipment like x-rays. All of those things are just little details that I think are really important to pay attention to. Other things to keep an eye out for is just the overall structure of a corporate transaction. So when you're working in healthcare, a lot of the times we pay attention to regulatory issues, but it's important to, if you're not experienced in corporate work as an attorney, to speak with corporate lawyers as well, because that structure is very important. We worked recently with a very interesting company that had begun as a nonprofit, now is working on expanding into a corporation. and is looking to IPO recently. And we did a full analysis of their regulatory issues in the company and also their corporate issues. So just paying attention to corporate structure and not just the regulatory issues in your deal. And I
Phoebe,
think,
sorry, I was going
yeah,
to say we did get a question in the Q&A prompt, and it's from Jeff, and says, how will the destaffing of NIH and other HHS staff affect deals moving forward?
yeah. So we haven't seen too much of the results of this as of yet. I think it's possible that the destaffing could lead to either less enforcement or perhaps more targeted enforcement into the government's key priorities. So I think they're, just paying attention to what has the government indicated that they're looking to focus on, and maybe being more concerned and aware of those key areas.
Yeah, I would agree on one piece. I think you can naturally accept maybe slower reviews in certain aspects, but I think then for sure what it will lead to is probably a lot more scrutinized and targeted enforcement. And so this is where sure enforcement will shift, but I think too there's also going to be a reliance, or maybe a higher reliance, on third-party contractors too, right? An important piece to remember here is HHS very much already does, as well as the payers, lean on UPICs, MACs, other third-party enforcement agencies that act as contractors to the government to identify potential issues. And so they're essentially a feeder system of potential compliance issues. And so this is where I think there's going to be a lot more maybe targeted enforcement that's looking at specific deals, and why we talked about earlier where certain transactions increase that regulatory enforcement radar on a company based on the points of the deal itself. It's a great question, Jeff.
Absolutely.
So I want to be respectful of everyone's time. That is the only question that we had. And of course, like we said at the top of the presentation, you will get a copy of these slides and the recording itself. We would love to hear back from you, whether it's feedback about the presentation itself or any questions. Our emails are on the screen here. We want to thank you guys again for joining us either during your lunch hour or just after, if you're on the West Coast, kind of earlier in your day. We look forward to the next one. Phoebe, thank you so much for joining me and co-presenting.
Thank you so much for having me.
Thanks, everyone. Have a great rest of your day.